Welcome back to Fluvoxamine Frontiers, battling COVID 19, where we are unraveling the surprising role of fluvoxamine in the fight against a global pandemic. I'm your host, Dr. Soma Rohatgi, and I'm thrilled to be back with Saakshi Sharma, who has a knack for decoding complex science. Back with us. In our first episode, we explored how fluvoxamine, a drug for mental health, stepped into the COVID 19 spotlight. Today, we are diving into the nuts and bolts, its chemistry, what exactly makes fluvoxamine structure and behavior in the body so special. Let's break it down simply. Picture fluvoxamine as a master key, carefully crafted to fit the specific locks in your body, like the sigma 1 receptor, which helps control inflammation. Fluvoxamine's chemical structure is what makes it fit just right, and its long half life. How long it stays active in our system is like a slow release battery, keeping it working for hours. How does this chemical wizardry makes fluvoxamine a COVID 19 contender? Let's find out. Saakshi, I welcome you back. Let's start with the molecule itself. How does fluvoxamine's chemical structure differ from other SSRIs, and why does this make it particularly suitable for tackling COVID 19?
Great question, Dr. Soma. And I love the master key analogy. It's spot on. Fluvoxamine is a selective serotonin reuptake inhibitor, or SSRI, like its cousins, Prozac or Zoloft. But it has a unique chemical personality. Structurally, fluvoxamine has a trifluoromethyl group and an oxime ether in its makeup, which sets it apart. These groups enhance its ability to bind to the sigma 1 receptor, a protein in cells that regulates inflammation as well as stress responses. Unlike other SSRIs, which primarily focus on serotonin reuptake in the brain, fluvoxamine's sigma 1 affinity gives it an anti-inflammatory edge. In COVID-19, where the immune system can go into overdrive with a cytokine storm, this binding helps calm the chaos. Early studies like those from 2020 showed fluvoxamine's structure allows it to interact with this receptor in a way that reduces inflammatory markers, making it a standout for COVID-19 compared to, say, fluoxetine, which has weaker sigma 1 activity.
So it appears that fluvoxamine's got a unique chemical fingerprint that unlocks this anti-inflammatory door. That's fascinating. Sakshi, you mentioned its long half-life. Can you explain what role this plays in fluvoxamine's effectiveness for acute infections like COVID 19 and why it matters?
Absolutely. The half-life of a drug is how long it takes for half of it to clear from your body. And fluvoxamine's is about 15 to 20 hours, which is relatively long for an SSRI. Think of it like a firefighter who stays on duty for a full shift, not just a quick visit. In acute infections like COVID-19, timing is very crucial. The virus triggers inflammation early, and you need a drug that sticks around to keep that response in check. Fluvoxamine's long half-life means that it maintains steady levels in the blood, providing consistent sigma 1 receptor activation as well as anti-inflammatory effects. This was key in trials like the Together study, where patients treated early with fluvoxamine had fewer hospitalizations. A shorter half-life might require more frequent dosing, which could be tricky in an acute setting where patients are already overwhelmed.
That makes so much sense. A drug that stays in the fight for the long haul. Now let's get practical. Are there challenges in dosing fluvoxamine for COVID 19 compared to its use in mental health conditions? And how do clinicians navigate these?
That's a critical point, Dr. Soma. For mental health conditions like depression or OCD, fluvoxamine is typically dosed at 100 to 300 milligrams daily, often titrated slowly to avoid side effects like nausea or even insomnia. In COVID-19, studies like the Together trial used a standard dose of 100 milligrams twice daily for 10 days, which is a more aggressive and short-term approach. The challenge is balancing efficacy with safety. For COVID-19, you need a dose high enough to hit the sigma 1 receptor hard, but not so high that side effects overwhelm patients who are already sick. Another issue is drug interactions. Fluvoxamine inhibits certain liver enzymes like CYP1A2, which can affect how other medications are metabolized. Clinicians have to be cautious, especially with COVID-19 patients on multiple drugs. They navigate this by checking for interactions, starting with lower doses if needed, and monitoring for side effects like drowsiness. The good news is that fluvoxamine's long track record in psychiatry gives doctors a solid playbook to work from. But it's still a bit like walking a tightrope to get the dose just right.
So, this concludes that it's about precision, finding that sweet spot where the drug works its magic without tripping over other medications. Fluvoxamine is like a master key, crafted with precision to unlock multiple doors in the body's defense system, doors to calm inflammation and steadier immune responses. Its long lasting power, like a slow release battery, ensures it stays active, keeping the city of your body safe from the wildfire of COVID 19. Thank you, Saakshi, for breaking down the chemistry behind this remarkable drug. Until then, keep asking questions and stay curious.